Welcome back to the Morning Blend. Over the holidays, did you notice anything different about your mom or your dad? You can tell that they need extra help maybe, but what do you do now? Joining us again is Dr. Salerno from Amada Senior Care of Greater Milwaukee to chat a little bit about that. Great to see you again.
Thank you for having me back.
The last time you were here, I remember, was in November, before Thanksgiving, so before all the holidays.
Sure.
What kind of a response have you had since
We've
then?
had a fairly strong response. We get a lot of inquiries. We've been able to help a lot of families. And so now we're at that post-holiday with the new year. I think it's a nice opportunity to come back and help to reinforce a couple of the messages.
Yeah, I think it's good to reinforce this because a lot of people probably notice things over the holidays. It's a time where we tend to spend a little bit more time with family, including our parents who might be aging, and you might notice some things that have changed. Yeah. Talk a little bit about, as you see an aging parent or grandparent perhaps declining, what services do you provide to help? Because a lot of people want to stay in their own homes.
Correct, yeah, and we do the in-home care piece. So we can help with basic activities like helping with a bath, helping with some laundry, helping with getting up in the morning. We also try to figure out what's the best plan of care. So sometimes it calls for care outside the home, and we can also help with that as well.
That is wonderful. I think in terms of what your company does, it's helping people then stay in their homes.
Correct.
It's that kind of service. You even provide 24-hour care,
we sure
right?
do. Yeah, absolutely. Yeah, sometimes there's usually like a medical need for that. Sometimes it's hospice at home. Sometimes it's a surgery recovery period where we have the caregivers in around the clock.
Okay. In terms of paying for care, a lot of people probably have some stress about that. Are there different ways to pay for the kind of care and the services you provide?
Absolutely. That's a lot of the information that there are ways to, for example, a lot of the veterans we talk to don't know that there are opportunities that are available within the VA. There's people that with long-term care insurance, they've purchased a policy 10, 15, 20 years ago. They don't know that, how do we get the money out to pay for care? And not a lot of people know that we can use life insurance potentially to pay for care as well.
I've never heard of that before. Do you see challenges with what you do with the long-term care insurance?
Yeah. See, we encounter people that purchase insurance policies when they were middle-aged and younger, healthier. Now they're advanced age and they just, they don't want to deal with the insurance companies. So we help with a policy review. We are long-term care insurance experts when it comes to claims. And so we really help our clients get through that part.
That's fantastic. In terms of hospitals and rehabilitation, because often there's care that's required after people leave those types of facilities. Right, how do you see those challenges and how do you see helping people work through those problems?
Well, when you leave a hospital or when you leave a skilled nursing, you don't want to go back. You want to get home, you want to get healthy. One thing we see is that there's to minimize the opportunity or the risk of the readmissions, we work with hospitals and skilled nursings on the DART program. And that's what it is. It's basically a problem-solving approach to reduce the readmissions.
Okay. And DART stands for Discharge Admissions Reduction Team,
Correct.
Right? So this is designed specifically for hospitals and skilled nursing facilities who are in a position to discharge patients, and then they often need additional care or continued care.
Right. Yeah. So this is really a message to the hospital administrators, case managers, where we work with you to figure out, number one, how do we get the patients home safely? How to improve the outcomes? And also with all the Medicare changes, then we don't want the hospitals or skilled nursing to have the penalties if the folks come back.
I see. Okay. I often wonder too, when people are trying to have this conversation with an aging parent, it can be really hard because you don't want to hurt someone's feelings or insult them. There might be some embarrassment with seeing some declining skills in someone. Do you help people with ideas for those conversations or assist in any way?
Exactly. We see sometimes where, for lack of a better word, pride is in the way.
Yeah.
And so, here we have independent folks that have lived in their own house for a number of years. Now they're inviting a person in to help them. Yeah. And so we try to understand what are the true needs, and maybe it's not all day, maybe it's only the morning time, or maybe it's only the afternoon or the evening time. And so we try to really have almost like a customized approach to each person.
And to see it as something that's very positive, like, hey, let's get a little bit of help with some light housekeeping
Correct.
or with some daily tasks.
Exactly. They
or
get to know the
grooming.
caregiver, and they get to really appreciate that interaction.
It's like a friend
Yeah.
who visits and helps, which I think is fantastic. And right now for this month, this is wonderful. You have a complimentary consultation for the first hour of care is no charge for new
Correct.
clients, which is really nice and a great way to introduce people to the wonderful services that Amada offers. So what you need to do is call and make sure you mention the Morning Blend when you get that complimentary consultation. You ask for that first hour of free care, or visit them at amadamilwaukee.com. Great to see you. Thank you.
Okay, thank you.
Appreciate it.